Well, welcome back, everyone. Today we have Paige Wagner, Lima Memorial Hospital dietitian, with us today to talk about chronic disease prevention through nutrition. So thanks so much for joining us, Paige.
Thank you so much for having me.
My pleasure. Now, firstly, can you explain how specific foods and nutrients impact our susceptibility, there we go, I got it out, to chronic disease?
Yes. So one of the things that I always tell my patients is, if you think about it, if we only eat really ultra processed foods or really heavily processed foods, think of your chips, your cookies, cakes, kind of all of those junk foods that we all tend to think taste really good. They're empty calories. They aren't giving us the nutrition that we really need. They don't often have fiber. They don't often have antioxidants, vitamins, minerals. So when we eat those foods, they're often easily stored on our body as fat. When we tend to gain weight and become obese, that increases our risk of all kinds of health issues and all kinds of chronic diseases. Another thing that it increases is our risk of high blood pressure, which we know leads to all kinds of other diseases. Many of those foods are often very high in salt, which is something that as Americans, we tend to eat way too much of anyways. So when looking at chronic disease prevention, try to avoid those really heavily processed foods and aim for more just fruits and vegetables, however you want to eat them in whatever form.
All right. So Paige, what kind of food should we be adding to our diets to prevent chronic disease?
Great question. So we often talk about all the things we shouldn't do, right? But we don't focus on how can we make it easier for ourselves. So adding lots of fruits and vegetables is going to be your best bet. I always tell my patients, I don't care how you want to eat them. If you want to get frozen, if you want to get fresh, if you want to oven roast them, air fry them, as long as we're not deep frying stuff, that's one of the best things that we can do is eat a variety of them and cook them in all different kinds of ways. That's usually your easiest way to get those in.
All right. So what are the most significant challenges individuals may face when it comes to adopting a healthier diet? And then how can they overcome those challenges?
Great question. So one of the biggest things that my patients will tell me that they face is a time constraint and also kind of knowing how to shop at the grocery store or use the fruits and vegetables. Some of my patients will share, I buy cucumbers or I buy zucchini, but I don't really know what to do with it. So finding ways to use those foods and finding recipes and different ways to cook them is usually how we can overcome those barriers. It does take a little bit of time, but if you're willing to put in a few extra minutes here and there to cook these foods, you're really going to come out healthier on the other side. So my best advice is plan ahead. When you go to the grocery store, try to find, just like I mentioned, a few fruits and vegetables here and there. Maybe you choose the ones that you're comfortable with, but throw in something that you're not as comfortable with and look up a new way to cook it. Often we will like these things, but if we don't know how to use them, we tend to think, I'll just eat something quick and easy. Ask your family to get involved. Ask them to maybe pick something. A great thing that I have my patients do is I have them make a list of all the fruits and vegetables, meats, things that they like, especially seafood. That's another great thing to add in that I forgot, but have them list out all of those things, take it home to their family, and have their family members also list out what they like. And then they can find easily what foods all of them can enjoy. And that way, too, they aren't feeling like they have to prepare 5 different meals for everyone.
Yeah, Paige, that's all great advice. Now, if someone would like some more guidance on nutrition and chronic disease prevention, who can they get in touch with? Who can they contact?
They can contact their primary care provider. If you don't have one, definitely contact us to set up an appointment to have a primary care physician on standby for you is a great thing. But they can also make referrals to other providers. So you can contact them. They can also give you a referral to see me and our other dietitian at the Comprehensive Health Center here, where we can help address a variety of your needs, whether it's just healthy cooking and finding ways to manage your chronic disease, diabetes, you name it. That's what we're here for.
All right. Well, Paige Wagner, dietitian from Lima Memorial, thank you so much for joining us today. I appreciate it.
Thank you so much for having me.
My pleasure. Well, don't go away because we have more when we return.